Is ALCL a type of T-cell lymphoma? Imagine a group of white blood cells called T cells, which are part of your immune system, suddenly turning into abnormal large cells. This is what happens in anaplastic large cell lymphoma, or ALCL. Yes, ALCL is a type of T-cell lymphoma, which falls under the broader category of non-Hodgkin lymphomas. Non-Hodgkin lymphomas are cancers that originate in lymphocytes, the cells involved in fighting infections. T-cell lymphomas develop specifically from T cells, and ALCL is one of the recognized subtypes. ALCL is characterized by large abnormal lymphoid cells that look very different from normal cells under a microscope. These cells are called anaplastic because they have an unusual shape and appearance. The disease is classified into four main subtypes based on clinical features, genetic markers, and the presence or absence of a protein called anaplastic lymphoma kinase, or ALK. The first subtype is ALK-positive ALCL, which is the most common form. In this type, the cancer cells produce the ALK protein due to a genetic mutation. ALK-positive ALCL tends to grow quickly but generally responds well to treatment and has a better outlook. The second subtype is ALK-negative ALCL, where the cells do not produce the ALK protein. This form is also high-grade but usually has a less favorable prognosis. The third subtype is primary cutaneous ALCL, which mainly affects the skin and is considered a low-grade lymphoma. It tends to grow slowly and often has a good outcome. The fourth subtype is breast implant-associated ALCL, a rare form that develops around breast implants. This type usually grows slowly and is different from typical breast cancers. All these subtypes share some features, like originating from mature T cells and expressing a marker called CD30 on their surface. This marker helps doctors diagnose ALCL accurately. Understanding these differences is important because treatment options and prognosis can vary depending on the subtype. In summary, ALCL is indeed a type of T-cell lymphoma. It is classified within non-Hodgkin lymphomas and has several subtypes based on genetic and clinical features. Treatments may include chemotherapy, radiation therapy, targeted drugs, or stem cell transplants, depending on the specific type and stage. Always remember, if you or someone you know is diagnosed with lymphoma, consulting a healthcare professional who specializes in blood cancers is essential. They can provide personalized advice and the most current treatment options based on individual circumstances.